Hey JP.
How's it going?
Not bad. Yourself?
Good.
Good. So I think today, there was quite a big an event in the last few months, and also I'm giving a small talk on Monday on party and play, and so we thought it would be nice to me learn from you about party and play and the treatment. B, a second thing where I practice my talk here and I present it here.
Sounds good.
And the third one is a Q&A after I've done the deeper dive into the literature, just so that I understand it better. And if you have any questions for me as whatever it is I do at my job, we can add that to it as well.
All right, sounds good.
So I first got exposed to this whole concept. I don't know, I think it was at St. Mike's for about a year or two. And I had a few patients that were using crystal, but also developed psychosis. Mm-hmm. And so I'd give them olanzapine when they had psychosis or whatever it would be for that week afterwards. And they'd sleep at night and then the psychosis would get better. And I realized, all I was asking about crystal was, have you used or not? Mm-hmm. Which is ridiculous, right? Because in anything else, you ask, what does the drug do for you? What do you do it for? All this kind of stuff. And the one person that I was seeing, but I've heard this story numerous times, I've heard from many people, is that when they would start using crystal, it was for fun, it was for sexual experiences, and then it came to the point that it was alone, right? Like after a while, they just didn't feel comfortable in public, they would end up using alone in some way. And it wasn't a pleasurable experience. It would be like a day or two, 3 days, 4 days, and then paranoia and psychosis afterwards in some way.
Right.
And yeah, we were really lucky after you started where, is it David Stewart?
It is, Dave Stewart, yep.
Dave Stewart.
Who is an epidemiologist, I think, by training.
Yeah, I'm not sure he has tons of papers. He's not an MD, but he has tons of papers, lots of knowledge. And he came here and he was giving a training through OHTN, I think, a half-day training on party and play and the treatment for it.
Yes.
And I was covering the inpatient unit, I couldn't go. And also, I think you were on our team, and I was just like, JP, would you be interested in this? I think you said yes to everything. I don't think you ever said no to anything. And then you went for the day, and then I sort of forced you. I said, and I want you to teach me and teach some residents about it afterwards, right? And so when we had residents, it's okay, teach them about this party and play thing and teach.
Yeah. Maybe we can back up and kind of get a definition of what party and play is, and I think in a lot of literature it's called chemsex, which is a term that and I'm 99% sure it's Dave Stewart. I'll really screw this up if we didn't get his name right here. But
I went to school.
But yeah, let's just assume it. I'm pretty sure that's what it is.
Okay.
Whip's coming back to us now.
No, I'm listening. They can hear me.
Good.
Right. So you're going to explain what chemsex was?
Yeah. I think Dave Stewart's definition of it is, or his terminology that he coined is chemsex. I think more in the North American context, it's called party and play. But specifically, this is for a class of drugs. Generally, it's crystal meth and GHB. Yeah. These are the two drugs that it encompasses. And a very common question is, well, can't straight people do it too? And absolutely, there are people that are straight that use crystal meth and they use GHB and they can use it for sex. But the terminology of party and play is kind of limited to the gay community for a couple reasons. The primary reason of that is that there's a lot of other stuff that goes with being gay that makes this a very difficult problem for folks to deal with. One is kind of homophobia, in that people have never belonged. So this is something that allows them to feel belonged in a hurry in a bit, right? Like it allows your inhibitions to drop and allows people to feel welcome into a little community quite quickly. But yeah, and sorry, that was one of them. I don't know what the other one was right off the top of my head, to be honest with you, but as to why it's in the gay community. But that's the primary reason is kind of the homophobic and stigma I guess stigma would be the other thing.
So the fact that people don't feel accepted in other places, and all of a sudden you have this world where you're unconditionally accepted for who and how you are.
Right. You belong. It's a little club. It's a little club. And so I'm going to, like, there's a little club. It's got its own little terminology, like its secret handshake, so to speak. And I even wore this shirt for this talk. I don't know if people can see it there. If people can see it, it says, get to the point, right? So who knows what get to the point is? I'll bet nobody knows what get to the point is.
I don't know
It means a common phrase, right? But it means get to the point is an expression that you would put in a grinder hookup, in any sort of personal posting that you'd put up on any website, and it means injecting drugs. Get to the point. So it's a, you know.
Oh, okay. So this wouldn't be someone who wants to snort or smoke.
Right.
This would be injection.
Right.
And you're telling people that
I like to get to the point. It's just this phraseology.
But does it specify which drug, or can it be?
No. So again, these are just people that are injecting in the context of party and play. So this is just meth.
Oh, it's just meth.
Yeah. Just meth. So this is, if you see this in a personal ad, I like to get to the point. You know, if you didn't know what it was, it's like, okay, this guy's a straight to it kind of guy, right? You wouldn't know what that meant. But if you're in the club, you know that means he likes to slam meth, inject meth. One thing
that I would also see, and I think this speaks a little bit to the homophobia or the internalized homophobia people sometimes have, is you sometimes have people that are in relationships, they're married, all this kind of stuff, and that's their time to have same-sex relationships or relations.
Right.
It's in this environment with these drugs. It's almost like they're allowed to be a different person for those few hours.
Absolutely, and there are some very negative outcomes that sometimes happen in those scenarios where you've got people coming into the community for a weekend, for a night, right? Sometimes they're into a bathhouse, and I mean, can you imagine what the fallout for that is, right? When the wife and children and the family and the connections don't know where you are, they think you're in another city. I can, recount multiple stories, and I won't do it here because they're kind of
personal. We have to be careful.
Yeah. Well, no, they're not because of my work. They're because of my life.
No, but still,
yeah,
it's not our job to share other people's stories.
But you can, you can put the pieces together. If you told your wife and children you're, going to New York for a business trip, a conference, and you never made it to New York, but you ended up in Toronto at a bathhouse instead, and unfortunately, these substances are very dangerous, and some people can't handle them, and some people end up passing away. So,
oh my goodness! So you're telling me that people will end up using things that their body's not used to?
Absolutely.
Or they can't predict what's there, and they'll
100%.
And then they're found in the bathhouse.
Yeah.
Oh my goodness! Right? Because it's so it really is this accidental death, right? Where nobody wanted the other person to die.
Right.
And then it's such a shock for the family.
But the family doesn't know that their partner is their father, and their husband is likes to occasionally bisexual or.
Yeah, no, but when things happen in the shadows, it's just it ends up being this dark world that nobody knows.
And then it actually ends up being, and in this particular case, which I won't go into details, it ends up being a knock on the door from a police officer in that town.
Yeah, here I thought we were just going to talk about treatment and hope. I was like, I sent you this, but I guess you're right. I mean, how do you fully appreciate the importance of the treatment if you don't know the harms of not having it and not offering that? Treatment, whatever.
So this is not a consequence-free scenario, right, for people. And you brought up I don't think the majority of people are.
Oh, it's a very small subset then.
That are doing it. We would call that on the down low, if you will, on the DL, like people that are living a straight life during the week and then doing that on the weekend, because that's inherently anyone that does this knows there's risk in it, and they probably hopefully wouldn't put themselves in such jeopardy, but it does happen.
It's a small percentage of people. Most people there are fully embracing the culture.
But they're fully embracing the culture, but it's still a closeted culture. Even in that, because even in the gay community, you wouldn't. Just full disclosure, I happen to be part of the gay community, so I'm not, not that that's necessary to disclose here at this point, but being, partying and playing or using crystal meth isn't what isn't accepted in the gay culture. It's looked down upon, right? So
I didn't know that.
Yeah.
Oh, so it's a subculture, subculture, or whatever. I don't know. What
yeah,
the
well, I mean,
correct term
it is. I don't know if you'd call it a subculture, but sure, it's certainly not a. It's not a behavior that's accepted, and
it's got its own stigma with it.
Absolutely, yeah. I mean, every drug has a its own class of stigma, right? So, I mean, it's one thing to be at a a high-end cocktail party on a Friday night and doing a line of coke. That's one aspect, but that's a lot different than staying up until 4 the next afternoon on crystal meth.
Are you okay having these conversations?
Sure. Yeah.
Like going to the training for Party and Play, coming here, because it's deeply personal stuff, right? Like
it is deeply personal stuff. Yeah.
Yeah. I guess you just find your own way over time, to participate.
Well, I mean, ironically, it's sort of like going into that seminar was so informative. He's such a such a leader in this field, so articulate.
I mean, the other thing. I saw a few videos. He's just this warm, kind, caring, genuine person.
He absolutely.
Like it exudes in everything that he says, right? Like
100%.
And how he is with everyone, right? At least from the videos I've seen, it just you feel that energy, right? And all you feel is like this warmth and care,
yeah,
and like genuine love. I don't know if you're even allowed to say that, but it's just genuine love for humanity as a whole.
Absolutely, he is a genuine person through and through, and it came through meeting him and talking with him and sitting at a table with him, and he was a charming man, and he is as he appears on his videos. So
wow.
That's the real deal.
I wish I found coverage that day. I mean, it's not often you get to meet these inspirational people, right? That are really doing. I don't even know if you're allowed to say that they're really doing God's work, right? If there was such a thing, right?
Yeah.
So where do we go here? Should we understand the harms, or should I hear about the training? What do you think would be?
Well, I mean, maybe it's understanding the harms. I mean, I think that's kind of a baseline. Everybody knows the harms of these substances. I think most people know that crystal meth, GHB, these are drugs that are kind of harmful. It's up to you. I mean, we can define the culture a little bit more so people get an appreciation for what we're even talking about. Because I'm not sure which in the series of videos this is gonna appear, but if it's the first one, then maybe we define a little bit more about what we're talking about. Does that make sense?
What are we talking about?
Well, I mean, so yeah, what is Party and Play? What is it? Is it going to doing just in a regular kind of? This is all in the context of casual hookups that happen between generally men. Always men in this case, in the context that we're defining it, and there are, this is not a one and done kind of scenario. This is scenarios where people are often having almost always having multiple partners. You're talking about scenarios where it would not be uncommon for someone to have 10 sexual partners in a period of 24 hours.
Yeah, so it has been to be very, very high risk, right, in terms of transmission of...
incredibly high risk.
Yeah, all diseases.
And there's just something about crystal meth that kind of, rewires your brain in a little bit of a weird way that it's almost like when it's more and more and more. I don't want one, I want, I don't want one encounter, I want 10 encounters.
Is that the way that David also framed it as well, right?
Absolutely.
About how the drugs, so it's almost like whatever you're enjoying is not enough, right? Like
right.
You might enjoy that one time, but you always want to push that limit in some way, and whatever risk you decide, right? That's the part that gets expanded.
Right, whatever risky, yeah, I mean...
Because there's so many different ways of being risky, right? Like it's...
There are so many different ways of being risky, and that's... and with these substances, it allows you to explore every one of them and all the inherent dangers that go with them.
Yeah.
So, where it's often about getting the hookup. It's not necessarily about even having the hookup, right? It's about, the next hookup. So you're always like planning, while you're in one hookup, you're planning the next hookup. And you don't want one partner, you want two partners. Now there's two partners. Let's have a group. Let's have 4 people here. Let's have 6 people here.
It just sounds like an addiction. It sounds like gambling. It sounds like always needing to level up, right? In terms of whatever that... enjoyment or thing is in some kind of way. And with crystal, it sounds like that the enjoyment part can get extended quite a bit, right? So it's not just like, you eat a bunch of, I'm sorry for these metaphors, you eat a bunch of candy and then you're good, right? Because then you feel sick and you vomit. With crystal, you can keep having these encounters, wanting more, getting that joy with more, and then there's a crash later.
Absolutely, yeah, and it's just all about the more and the more and the more, and it's never you just more and more extreme behaviors. So I'm going to coin a phrase from Dr. Stuart one more time here, which is it's a little graphic, but I think it's a pretty graphic topic. We should be when one fist isn't enough.
Gotcha.
So I don't know if people can put that in.
Yeah, but I think I think it's something that people like me that want to help people in these situations need to be more aware of, because I think unconsciously or consciously, when we're not comfortable going into an area, people aren't going to bring that stuff up. If I'm doing a clinical assessment, I'm trying to really figure out the risk, but I just ask, oh, did you use this weekend, and that's it, and there's no. It's almost like I would have to have some way of demonstrating knowledge and comfort around the culture before somebody would really feel comfortable sharing, because it's...
Right. And if we're being totally honest, even that phrase kind of seemed like it made you a little queasy when I said it, when one fist isn't enough, but...
Yeah, and part of it is also like...
Because
it's also being recorded too, right? It's also being recorded, right? And then part of me is thinking about, like, what's my nonverbal saying, what's my body language saying, all that kind of stuff.
But if you're uncomfortable, or if any other clinicians that are seeing this are uncomfortable, then that's something that has to be dealt with, right?
Yeah,
we have to normalize these behaviors, right?
Yeah.
We have to normalize it. We have to accept it, and that's you're meeting the patient where they're at. So if they think that you're not comfortable talking about it, that's going to be something they feel, and they're not going to talk about it.
Yeah, I was just thinking of two colleagues, and I would say friends. Tim always used Tim Guimond. He runs HQ now here in Toronto. He'd always tell me sort of stories where he'd add certain things to the story, right, around dangerous behaviors and risks. And he brought up the fisting thing a couple of times as well. And I think part of it was just to get me comfortable, right, like with hearing and having these conversations, because if you don't show that comfort, it's not there. And then another colleague, Adam Bush, who I don't know, I think he's a phenomenal therapist, right? I've only seen him in the clinical settings where we're learning different therapies together, and he works at ACT in Toronto.
Yeah.
And he has a group where they do therapy for this. And what he said, they had to change their name completely. They couldn't call it like chem. They had to have they had a little kinky name-ish thing, and then they had the topics were all a little bit sort of kinky. So it's really just creating that environment that it's okay to talk about this. And with Tim,
this is at ACT in Toronto. I've met Adam. A great group. Great program. Amazing program.
He's so skilled. I don't know how he. I mean, I guess there's great people at everything, right? So I just don't know how he's become such a great therapist. I would love to have some of that skill set. And then the other thing is, I mean, even though we're talking about things like, one fist, two fists, whatever it might be, even I noticed with Tim, whenever he's teaching, he'll tell stories about his husband or other things like that. And when I was asking about it afterwards, it's not because he wants people to, he just wants to normalize talk about men being married or whatever that is, right?
Yes.
And so by talking about all these things, just like where his body language, everything's like, this is just, I had a coffee and I'm with my husband, and that person is two fists, not one. Like whatever it might be, the point is that it just once you normalize the conversation, you create the space. Because I even think about things in medicine or therapy, say around suicide, right? So when somebody has suicidal thoughts, the therapist gets uncomfortable, the patient gets uncomfortable. The therapist like, do I have to report this? What's going to happen? Do I bring him in? The patient's like, oh no, they're going to report me. Do I bring him in?
Sure.
And so it's almost like our nonverbal makes it okay just to talk about the safer things. Like, oh, it was good. Oh, I had trouble with my sleep. Oh, my appetite's not so great. And you just completely leave out that every weekend, you feel suicidal after a weekend where you're out at a bathhouse, right? And your wife and your kids don't know about it.
Sure.
Or whatever it might be.
Right. And that's, and I'm sure that's a segment of the population as well. But most of, that would be a problem for some folks, absolutely.
But it's different problems for the folks you're talking about, right? And,
right. So these are some folks that are in this that are at the point where they're in it, and it's a full-time thing. This is where you're at.
Oh, it's not just like a weekend,
not a
or
weekend
once
thing.
a month, or like
No,
on Christmas.
because
Like it's
no, it's not just a Christmas.
daily.
It is a daily thing. It's a daily thing, and when you're in it, you're in it, and and the behaviors become more extreme and more risky as time goes on. And
how long do you think that someone could be using crystal and get that high from these experiences? Do you think like a week straight, a month straight? Do you think someone can go a year straight?
Well, okay, so there's a limit to how long someone can stay up. Whether or not I've heard people staying up for 10 days. That's a very extreme scenario. I think, but people staying up for 5 days it can be quite common doing this. Then you're sleeping, and then you're it's almost like a rinse and repeat kind of thing. You're starting again, right? You're catching up on your sleep. Maybe you'll sleep for 18 hours. And you're saying for some people it's GHB, that's what it does. So for some people the G is more about the sexual disinhibition, other people it's about sleep. So for me personally, GHB was a harm reduction thing because it allowed me to sleep. Because without the G, I would just stay up on crystal meth. So you'd be on meth the whole time, and then and staying up for days on end, it can be very dangerous to someone's health, right? Yeah. And so I found that G was actually helped me. So every drug has a bit different function of use for different people. Some people will just do G by itself, will not do crystal meth. I mean,
those are the stories I usually heard. I hadn't heard the sleep one from people I've worked with.
Yeah, no, I haven't heard it either.
Oh, okay.
So it's not common, but it's for me it allowed me to sleep.
Gotcha.
But I think but the longer you stay up, for whatever reason, it appears in this people become more extreme and less what's the word?
Disinhibited.
Disinhibited. There we go. Disinhibited to more extreme behaviors, right? So there's I don't know what you want to talk about some of those extreme behaviors you want to that leads into sort of things like bug chasing, for example, is very common in this field as well, right? So this is something that connecting the crystal meth to people that are doing these behaviors it happens quite commonly, because you remember you've got people that are not. I don't know. There's almost nobody that I've seen that is having protected sex on day 3 of being up and party and playing. It's almost unheard of in any scenario with party and play, but sometimes it may happen. But by day 2 and day 3, it's definitely not happening.
I just I find these conversations tough because these people they're very real, right? It's not like this abstract hypothetical person, and it's hard for me to think about. I imagine the emptiness, the isolation, the disconnectedness people have when they're on their own, and how all of that disappears when they're in these experiences. And I think about like what's it going to take to make somebody's sober life meaningful and enjoying, and we're at a stage right now when people are in that. I'm going to use the wrong words, but like in the culture, in that environment, living that life. There's no way I can present a picture, or that people would talk to me or come and see me, say that, hey, this is what it could be like. And then the risks are, they stay with you, right? Like these risks are real, and it's, and unless in my work, I find a way to create an environment where these things can be discussed, I may not be able to have the dialogue on behaviors that can reduce the harm, but still get some of that pleasure or whatever they want, right?
Sure.
And maybe it'll never be through someone like me. Maybe it'll be just having a peer or a lived experience person on the team that can help be that gateway to medical care, right? Like where people where like you might have worked with, where I had no idea about whatever was going on otherwise, but I provided some medical care for whatever addiction medicine does, for them.
Sure, but I think having these conversations is important. I think normalizing this talk is important. Like I don't think we've gone over any barrier of language that we're not able to speak about in the forums that we present this stuff in. So I think normalizing it and bringing it out into the open is key, and I think that's a first step, right? So people know these terminologies. People know even went for it's not a how-to guide, but like for example the other in another back to the personal listing, kind of 101, if you see everybody's listings with capital T's in the, in words that wouldn't have a capital in the middle of it, right? That the T represents, Tina for crystal meth.
Oh, okay.
So if there's an inordinate number of capital T's in a regular phrase.
Does that mean that's what they're looking for?
That's what they're looking for, that's what they do, that's what they're doing.
Got you.
So capital T's or capital G's.
People find lingo. People find lingo.
People, again, back to they're in this club.
And it probably evolves, right? It probably evolves. So if people figure something out, and then it's a concern, they'll come in with the new lingo. It probably evolves over decades, right? Like it's...
Yeah, it might. Yeah, so back in the day, it would have been, I like to go skiing, right? You know what that would mean?
No.
I like to skiing means snow, which is a reference to Coke, right?
Oh, okay. Yeah.
Or I like to live, I'm playing in the clouds today. It means I'm smoking meth.
Gotcha.
There you go. It's the 101 of...
I find I always have to ask. Like, I always have to ask, and I always try to be curious, and...
So one of the things Dave Stewart teaches is to try to normalize this and to come in and say, do you like, he says when he goes in and sees a patient, he puts a big smile on his face and says, do you like to party with drugs, right? He says it just like that, right? That's how he presents it. So that kind of normalizes it. Then you're not sort of like, oh, I don't know, I don't want to be this person. I don't want to tell this doctor anything, right?
It's open.